High rates of psychoactive medicine use in the absence of talk therapies, deficits in patient monitoring, and higher rates of polypharmacy than is considered standard practice. They are some of the findings of an independent review into the North Kerry Child and Adolescent Mental Health Service, which found a risk for harm in over 200 children under its care.
This review into the Child and Adolescent Mental Health Service in North Kerry was commissioned by the HSE in 2023, after a random audit of files identified a potential risk in the care of some children. It was conducted by consultant child and adolescent psychiatrist Dr. Colette Halpin. The review looked at 374 cases active on the CAMHs database in November 2022. It identified the risk for potential harm in 209 cases. In 195 cases, the risk was moderate. In 2 cases, the risk was found to be major. And in 12 cases, the risk was determined to be minor. The Irish Medical Organisation said there was a lack of fully staffed CAMHs teams.
Patients are not getting proper multidisciplinary assessments, and that leads to inadequate diagnosis, which leads to inadequate treatments and ongoing problems. We know that there's huge problems with recruiting the staff into these dispersed locations of community mental health teams.
The review found very high prescribing rates of anti-psychotic type medications, and almost all children with autism were given these drugs. There was also very limited access to talking therapies. The HSE said that later this year, to improve services, it will be rolling out a single point of access and electronic health records for the CAMHs service. In the Dáil today, the Taoiseach said there had to be accountability.
The first principle in medicine is do no harm. Harm has been done here in terms of the treatment of quite a number of young people in North Kerry.
The report also found the resources on the CAMHs team were significantly below what was recommended in mental health policy. Fergal Bowers, RTE News.
Well, let's go over to our southern editor, Paschal Sheehy now, who's in Tralee in County Kerry. Paschal, not the first report into CAMHs in County Kerry. How significant is today's review?
Sharon, this is an even more stark and damning review of the CAMHs service in North Kerry than a previous report into the CAMHs service in South Kerry, which was published in January 2022. That South Kerry report reviewed the cases of 1,300 children and found that 227 of them were exposed to the risk of serious harm. Today's report reviewed the cases of a far smaller group of children, 374, and it found that 209 of them, more than half of them, were exposed to the risk of potential harm. That risk was deemed to be moderate in the cases of over 200 children. And again, it's important to say that we are talking here about children, in very many cases, very vulnerable children as well, who have been failed here by the state's health services. I've been talking to the mother of a teenage girl who is one of those who was let down by those deficiencies in the CAMHs service here in North Kerry.
And she thinks that...
Mary lives with her family in an estate in Tralee, County Kerry. In 2019, her daughter was diagnosed by a doctor at the North Kerry CAMHs service with depression and PTSD, having presented with low mood and anxiety after being bullied at school. However, no proper assessment was done prior to these diagnoses. Mary says a cocktail of antidepressant, anti-psychotic and anti-anxiety drugs she was put on destroyed her daughter's quality of life.
It destroyed her. The medication destroyed her. She wasn't the child she used to be. Took everything from her. She had no friends. She didn't go out. She just couldn't, she wasn't able to function.
Mary queried the amount of medication the teenager was on, but trusted the medical professionals. She now feels betrayed.
I trusted them to look after my child. I didn't see where I had no other option. I had to trust them and trust that they'd look after my child. But they didn't. They done more harm than good.
Mary has rejected the apology the HSE offered her and her daughter and says she's instead focused on accountability.
They need to be held accountable. I have to be held accountable for my actions. So yeah, accountability is top priority. Apology will never ever be acceptable because it should never have happened. Compensation, it won't fix my child. It won't give her back what she's lost.
Solicitor Keith Rolls, who represents hundreds of CAMHs patients in Kerry, wants the review to be extended to cover all patients treated by CAMHs in North Kerry, dating back to 2010.
It's very clear that these problems date back to 2010 or so, and a review with no geographical guidelines to separate North or South Kerry or no timelines imposed on that review needs to take place immediately, and anything other than that is a cop-out from our perspective.
And Pascal, what will happen next now for these families that have been part of this review, families who haven't been part of this review?
Sharon, this evening we have statements and apologies from the HSE at regional and at national level. The HSE has also committed to conducting a further review of the CAMHs service here in North Kerry. Information about this is limited at this stage, but by my reading of the information so far, it appears to be quite limited and will not satisfy the calls from people like Keith Rolls there, who are advocating on behalf of all CAMHs patients in North Kerry for a review that would extend back as far as 2010. There's been a statement this evening too from the Minister for Mental Health, Mary Butler. She says she intends to put a non-adversarial compensation scheme in place, similar to the one that was put in place in South Kerry, and she's in touch with the Attorney General about doing that. The difficulty with that compensation scheme is if you were part of today's review, you are likely to qualify for compensation, but there were only around 370 patients part of that review. There are very many more who weren't part of that view and over which there are questions about the care that they received, and I'm sure those questions will amplify in the days to come. Mary Butler will be in Kerry tomorrow to meet some of the families affected. Sharon.
Southern Editor Pascal Sheehy from Tralee in County Kerry, thank you. As families, we are heartbroken and angry. These are not just figures on a page, they are our children who were already struggling and who turned to CAMHs for help. No parent expects that seeking help could make things worse. That's part of a statement from a group called Families for Reform of CAMHs, who've today called for more than reports and apologies. Well, joining me now from Tralee in Kerry is Solicitor Keith Rolls, who represents many families under the care of CAMHs in North Kerry. Keith Rolls, thank you for joining us on the 6-1 this evening. You've had a lot of time to look at this report, to read through it. It's a report that follows up from the review of services in Kerry South CAMHs. What did you think when you read this one?
Good evening, Sharon. Thanks for having me on. I have read the reports. I've read the reports several times today, and it makes for very distressing reading. We act for over 100 clients who are directly impacted by the contents of this report. And I suppose we take, in a civil case, we take clients' individual circumstances, and we're very familiar with those, but when all that individual information is collated into a general report, it makes for very stark and distressing reading, and it's caused a lot of upset and anger amongst Kerry families today.
It found things like a high rate of prescribing of psychotropic drugs, a lack of monitoring and a low rate of talking therapy. What is it that's of most concern to you and the families that you represent?
Well, we were expressly aware as to what the report was going to hold anyway, due to the fact that we'd attended up to 100 open disclosure meetings with HSE personnel and our clients. But you're correct, the inappropriate prescribing of anti-psychotic medication, the polypharmacy, which is prescribing of 2 psychotropic medications or more. There's some cases there where individuals are prescribed 7 psychotropic medications at the same time. It's truly staggering. The figures are so stark in the report that it takes a lot of time to process them, and it's only when you have the opportunity to review the report, and as I said, I've reviewed it several times, the more and more I read it, the more concerns I have in relation to the care that people have received. But inappropriate prescribing of anti-psychotic medication can have such a detrimental impact on children and young adolescents, and unfortunately this medication was not necessary.
One parent we heard from earlier on in the programme, speaking to our Southern editor Pascal Sheehy, said that her daughter was destroyed, and she said that compensation won't fix her child and it won't give her back what she has lost. So what needs to happen for these families?
Yeah, look, I'm very conscious of that, and unfortunately that is the case for a lot of individuals throughout the county. Hopefully the next steps will be that the state will incorporate a North Kerry compensation scheme similar to that was incorporated in South Kerry, and families will have the opportunity to seek appropriate redress without having to go through High Court litigation, which can be very onerous on several fronts and very distressing, obviously, for anybody who's involved in same.
What are the next steps then for the HSE? They've issued a statement this evening and they've confirmed that they are to carry out a review of some files in North Kerry prior to the period of 2022. But it's only some files. Is that enough for you and for the families?
Frankly, no, it's not. I think it's completely inappropriate. The writing is on the wall here. If it wasn't on the wall after the Maskey review, it certainly is now. 53%, over one in every two cases warranted an apology. This isn't about defined timelines. This isn't about the geographics of South Kerry versus North Kerry. This is about HSE personnel and children that were exposed to their harmful care. The only review that is appropriate now is to ensure that every single case that these particular clinicians and who have provided care to these individuals, that all cases are reviewed since they commenced treating these patients in Kerry. So timelines are insufficient at the moment. This is about the personnel who are responsible for the inappropriate care, and these personnel need to be held accountable, and every case where they have treated a patient, those files need to be reviewed without further delay.
Minister Mary Butler is due to meet with families there in North Kerry tomorrow. What do you think they will have to say to her, considering she said in her statement this evening that she is assured that the service has improved significantly since this review?
Well, thankfully, the service may have improved, but unfortunately, this isn't about the service as of now. This is about the service that people were exposed to over the last 2 decades or so, and the serious side effects and life-changing treatment that people have been subjected to. Inappropriate care, obviously, which centres around inappropriate medication, inappropriate assessments to ensure a comprehensive diagnosis, and several other deficits in care that I won't go into now. But the issues at large here have transpired, and thankfully there seems to be an improvement in the services that are being offered to individuals in Kerry, but that won't take back what transpired in the past, and that's why the HSE and the state need to ensure that they incorporate and undertake a full and comprehensive review of all Kerry files and not just North Kerry. South Kerry has been overlooked on the back of the Maskey report, and anywhere again where these clinicians have been treating patients, every single file needs to be reviewed without delay, and that's the only appropriate measure that can take place now.
Keith Rolls, solicitor in Tralee in County Kerry, thank you for speaking to us on 6-1 this evening.